Now we will hear from Wilson Palacios, who is actually from the University of South Florida as an associate professor, but he is here doing some work with CIRA as well. And he's going to talk about the conference attendance attendee survey that many of you completed. Wilson?
Thank you. Good morning, everyone. And as Leif said, I'm here doing some work with CIRA and over the next 2 years, and hopefully over that time, maybe some work with some of you in the room on this effort. The purpose of this short 11-item anonymous online survey that many of you participated in was to provide you a mechanism for informing us of your current and future efforts and needs in the areas of HIV prevention and intervention services. As you see, we have a total of 190 registered attendees, of which 133 completed the online survey. Going by question in terms of the role that you play in HIV prevention, the message here is clearly that we have a wide array of professionals in the field represented here today. What's most notable is the other category, as you see, which is at 34%. In opening up this category and revealing the qualitative data, I was pleasantly surprised to see that here too we had a wide array of professionals, most notably professionals from the areas of the medical community, medical case managers, grant writers, researchers, etc. In terms of services that your agency, organization provides, the message here is clearly that we have representatives from HIV Prevention Services, followed by HIV Care and Support Services. Again, the other category, as you can see, reveals even more interesting information. In terms of services agency is providing, we have partner services, STD prevention, in outpatient services, and medical case management. In terms of specific HIV prevention services, the message clearly here is counseling, testing, and referral, followed by comprehensive risk assessment counseling services. And once again, in opening up this other category, I was pleasantly surprised to see that the message here was focusing on partner services, primary care to children, and peer and non-peer outreach. In terms of particular capacity, here the message clearly is HIV positive, MS followed by MSM, IDU, or people who inject drugs, and high-risk heterosexuals. The other categories revealing college students, incarcerated, and formerly incarcerated populations. In terms of level of experience, clearly you see here that among those that participate in the survey, the experience is vast. In terms of agency planning, the message here is whether you intend to provide HIV services in the future, again here the message is one of commitment. In terms of training, we clearly here see that the message is one on outreach, specific interventions, general MSM information, and over 30% indicated need of training in techniques of community mapping and assessment. Opening up the other category, we saw individuals here indicating a need in training for focus groups and basically writing those research grants to help you get those dollars to continue your work to the next level. In terms of capacity building, the message clearly here is on staff development, new program development, and building collaboration. Okay. Under the other category here, I was pleasantly surprised to see that many of you indicated, again, funding, community-based sites to pilot and evaluate innovative educational platforms for MSM populations. And clearly here, in terms of in the field of HIV prevention, how much of a priority is HIV prevention for MSMs? Clearly you see here the message once again is on commitment. So a lot of positive messages, themes coming from the online survey that many of you participated in. In terms of the pop quiz here, as you can see, okay, in terms of the versus who, true versus false, I would say that the message clearly here is that your knowledge in the field, your practical experience, the day-to-day activities that you engage with in serving across the board many different types of populations translates into a very strong knowledge base. I think, with today's theme for today's conference, the challenge is taking the next step forward, and hopefully in a collaborative effort. Thank you.